Hi everyone. So today again I'm here to talk about preparation of oral rehydration salt. Before we talk about oral rehydration salt, we have to talk about what can make you what are the indications for oral rehydration salt. It is mostly used when you have dehydration or excessive fluid loss in a patient that you have excessive fluid loss, a person that has excessive fluid loss, especially in children that have diarrhea and vomiting. So you use this mostly in children that have diarrhea and vomiting. As you know, diarrhea and vomiting is the major cause of death worldwide, both children and adult, but it's mostly in children. It affects mostly children and elderly patients. So you have to prepare this ORS, and depending on the level of dehydration, you don't just give a child ORS. There's mild, there's moderate, and there's severe dehydration. Depending on the level, if the child is severely dehydrated, you don't need to give because the ORS might not really work for the individual. So you need to report to the hospital immediately when there's notice that there's severe dehydration, because a child can die within seconds. So you need to report to the hospital so that they can give together with the before you go on the ORS, they can give IV therapy to replace the lost fluid. Lost fluid can be when there's stooling, there's excessive stooling and excessive vomiting, there are electrolyte loss. Okay, so and this electrolyte, they help in maintaining body function. Electrolyte like sodium, like potassium, like chloride, like zinc, okay, like glucose, because sodium, it helps in absorption of glucose in the intestine, in the stomach. So it is very important. So the ORS contains these electrolytes. So as you lose it through process of vomiting or diarrhea, it's important you start giving the ORS immediately. You notice that some mothers, they don't know how to prepare this ORS, and also other people do it traditionally. They just mix salt and sugar, then or glucose, and then mix it with water and give. If you do that, you might not get the right quantity. That is why ORS is prepared. It is recommended by who? It is recommended by UNICEF, so that you know that you are taking the right quantity of salt and water, not taking this thing. And also, we are using ORS to not use, we not take alcohol or caffeine, or and also do not take sugary drinks, because it might hamper the mood of action. So you don't need to take, when you are taking this ORS, for it to work effectively, avoid taking alcohol, avoid taking caffeine, avoid taking sugary drinks or juice. Okay, so to prepare also, this ORS I told you is mainly used for diarrhea and vomiting, especially in children, but it can also, you can also give, it's also given to those who sweat excessively. Excessive sweating, you can give to those who sweat, especially like footballers, those who play football at the pitch. They don't drink ordinary water because they lose a lot of sweat. They sweat excessively. So you can give them this to replace the lost salts in the body. Okay, because like I said, if you sweat, you bring out salt. Okay, if you test your sweat, it's salty, so it brings out that salt. So you have to replace the salt. So they don't give them ordinary water to drink, because that can, if you give ordinary water, it doesn't have enough glucose to sustain them to run for 90 minutes. So you need to give them ORS. Also, burn patients, you can also do this ORS for them to drink. Okay, avoid giving this ORS to people who are hypertensive, people who are on the renal diet, who might not, who need a low salt, who doesn't need salt. You understand? So you avoid giving them. No matter how weak they are, it's better you take them to the hospital. So do not give this to people who are restricted from taking salt. Okay, so now, how do you prepare ORS? Children who are between the ages of 0 to 5, for to prevent, because this diarrhea is mostly caused by bacteria and viruses. How do you prevent them? You can prevent it for the virus. You can give a rota vaccine. Rota vaccine is included in the immunization schedule, so you can give rota vaccine to these children as they grow, so that they avoid, because if they start teething, It is when they start crawling, they start having this diarrhea and vomiting because they pick things from the floor, they eat things anyhow, they eat sugary things, so they can, it's the synthesis of having that diarrhea and vomiting. So the rota vaccine can help. Okay, so aside the ORS, the rota vaccine can help. So you give them rota vaccine to prevent the diarrhea and vomiting for a child. Okay. Also for a child who is vomiting and profusely and stooling frequently, you can give zinc. You can add zinc, okay, because zinc helps in stopping the severity of the stooling. Okay, it helps in stopping the severity of the diarrhea. So you give zinc alongside the ORS. So give zinc daily. They say give zinc daily for 10 days. Okay, so I don't want this video to be long. I'll be making it my next video to prepare the ORS, but I just wanted to give you a recap of why we use ORS and who should take ORS and who should not take ORS. So see you in my next video. Bye for now.